Dear members of White Army, welcome to you all for this career counseling session. In the continued series of career counseling sessions, we have today about residency in NIMHANS. Yes, one of the most premier institutes of our country. Every medico aspire to be studying at NIMHANS. So every medico's dream to be studying at NIMHANS. So let's know more about these details of residency at NIMHANS by one of our resource persons here with us. He's my beloved junior from Bengaluru Medical College and a perfect all-rounder, if not an exaggeration. He's a very good in culturals, excellent athlete and sports person, and exceptional in academics. Dr. Nadeem. Welcome to you, Dr. Nadeem. We are really feel privileged to have you with us in our White Army platform today. And he completed, after MBBS from Bangalore Medical College, he went on to do MCH Neurosurgery from NIMHANS, Bengaluru. And recently he has completed with overall topper, gold medalist. And he's continuing there as senior resident in the Department of Neurosurgery, an allied student and excellent opportunity working there in NIMHANS, learning from the legends there. So to discuss more about the students' doubts, Dr. Nadeem, the first question to you is, why NIMHANS? Why any aspirant or why any students prefers NIMHANS or other institutions? What's so special about it?
Yeah. So first of all, thank you for that overwhelming introduction. In fact, the definition of all-rounder would be Dr. Kishan Rao. We all followed your footsteps, and you have always been an encouraging senior throughout my UG days, and even now you have always encouraged me. Thanks a lot for that. Coming back to your question, first of all, NIMHANS is an institute of national importance that is primarily focused on mental health and neurosciences. It is probably the only institute in the country that is focused on these particular streams of medical fraternity. And it actually started with the concept that behavioral sciences and neurosciences, that is mind and brain, should collaborate together. Only then you can achieve internal well-being. That was the whole concept. And in fact, you will be astonished to know that the first neurosurgical procedure in NIMHANS was performed by actually a psychiatrist. Oh. So Dr. Govinda Swami, it is with his visionary idea that NIMHANS came into existence. And the history of NIMHANS goes back to 1848, where it was actually started as a lunatic asylum. Mm-hmm. It later became a government mental hospital. And on 27 December 1970s, that is when NIMHANS came into existence. Okay. And you will be surprised that the first surgeries of NIMHANS were very difficult to perform. They did not have an anesthetist. And they used to perform surgeries in the evening, and an anesthetist used to come from Victoria Hospital to assist these surgeries. So from that humble beginning, we are we are actually one of the most premier institute when it comes to neurosciences and behavioral sciences. And we have around 27 departments, of which neurology, neurosurgery come under neurosciences and psychiatry comes under behavioral sciences. We have around 16 consultants and 43 residents currently. And we have around 120 beds in elective side and around 60 beds in the emergency side. And in the past year, we have conducted around 7,500 surgeries, of which 4,000 were emergency surgeries. We have 12 OTs, which are state of the art, of which 3 are elective, of which 3 are emergency OTs, and 2 OTs actually have intraoperative MRI, which was first in the country.
Great.
And coming to the exposure, see, whenever a resident enters into the field of neurosurgery, in NIMHANS, you have 2 kinds of posting. One is the elective posting, other one is the emergency posting. The elective posting is basically in units. We have 6 units here, and each unit has around 5 residents. So basically, I'm going to explain the work pattern of a resident and how well the system is organized here that will help him to be a better neurosurgeon at the end of his course.
Correct.
So when these residents are posted in elective side, you have one first year, one third year, one fourth year, and one final year. And there is one chief resident, a resident like me who has just completed MCH. The first year resident is actually the backbone of the unit. He comes at around 6 a.m. in the morning. and he takes rounds of all the patients who are admitted. It includes pre-op, post-op patients, ICU patients, patients in step-down wards, all these patients. In an unit, around 25 to 30 patients will be there. So he takes rounds in detail, and sharply at 8 o'clock, we have classes. We have pre-op sessions where people present operative cases. The junior resident attends these classes, and sharply at around 9:15, the round starts. So the consultants participate in the rounds, and the rounds goes up to 11 o'clock. By that time, the elective OT side, they would have finished craniotomies, and the consultants will go there. The job of the junior resident now is to execute all the plans that were told in the rounds. So he's supposed to do all this work, and by evening 4 o'clock or 5 o'clock, the chief resident finishes the OT and comes back and takes rounds. One of the most important aspects that I have seen in NIMHANS is the work is very much organized.
Okay.
As a resident, you do doctor's work. You don't spend your time in blood collection. You don't spend your time in raising investigations, collecting investigations.
Correct.
All these things are actually done by the nursing staff. This is how a residency program is supposed to be. But if you take other places, the residents are indulged in these kind of work that they eventually lose interest in things which they are supposed to do. So since these things are done by the nursing staff, they do hourly GCS monitoring, input-output monitoring, all blood drawing, everything. So the resident has substantial amount of time to actually do quality work. So this includes admitting patients, seeing them in detail, doing procedures, and documentation, everything. So when the chief resident comes, that is when evening rounds are done. It is one of the most important rounds, because this is when the senior resident teaches the junior residents. It is more like a teaching session where we go to each and every patient and discuss about the patient's well-being and pick up subtle signs which patient might show, which will be actually helpful if acted upon early. So after this, after the evening rounds, the residents who all had gone to OT, they come down. And after that, we have a post-op call, which is routine in any surgical field. After the post-op call is given at 9. Sharply at 9, everybody goes back to hostel. So I want to stress upon the point that the residency program here has fixed working hours. That is from 6 a.m. to 9 p.m. You are supposed to be in the hospital, but after 9 p.m., it is the duty resident who takes all the calls. So unlike the residency in other institutes, the working hour here is fixed. Like in a field like neurosurgery, you tend to have alternate duties and you are always on the call, especially in state colleges where you have less number of residents. So no doubt you will have at least 7 to 8 hours of sleep, which is actually very helpful for a resident's mental health. And secondly, about the residents who go to OT. For example, the 4th year, final year, and the 3rd year go to OT. Every unit has almost 2 OTs per day. So the final year goes on one side, the 4th year and the chief resident, or the chief resident and the 3rd year goes on the other side. So this is the only place where a resident directly scrubs in with a consultant as a first assistant. If you take other institute, they have a lot of fellows and a lot of PDFs and assistant professors, lot of consultants. So it is but natural that in a case two consultants might scrub in, there might be a fellow, and the final year or the 4th year might be a 3rd or a 4th assistant. So the exposure that you get as a first assistant is definitely worth, and it is better than compared to a 3rd or a 4th assistant, because you are operating under microscope, and to get a first-hand experience, you need to be a first assistant. And when you scrub in directly with a consultant, you learn a lot of procedures. Correct. And the initial part of the surgeries and all you get to do. That is when your confidence improves, when you are operating with a consultant. That is one of the most important highlights that I had seen in NIMHANS. And the OT exposure is also gradual. If you observe the first year resident, I'm talking about the 5-year program, never goes to OT. He has to focus completely on the ward work, and he has to be thorough with the ward procedures. Only then he is allowed to go into the OT. That is after he finishes his Victoria posting. I'll come back to that later. And when he comes back, it is not that he is directly allowed to scrub in with the consultant. The work of the chief resident is to train him, teach him all the procedures, etiquettes of the OT, sterile procedures, scrubbing, everything. The resident is being taught from the basic thing. And that actually helps you. It gives you a graded exposure, and you learn things in a proper way. That is also an important aspect. And the senior-junior relationship in NIMHANS is totally different from other surgical fields in other institutes. It is very friendly. You can actually, you respect your seniors at the same time, you are very friendly to them. That is what I have experienced here. You do not feel that gap. When a first-year resident talks to a post-MCH resident, he doesn't feel any hindrance. He can directly communicate to him. And I feel that is very important in a patient's care, because if a resident is scared of certain things, he might not completely communicate to his seniors, and that will lead to missing certain important things. And when he's free, he can clarify his doubts and all these things. That is something which is very special about NIMHANS. And another important aspect is the relationship with the consultant. The consultants are always on call. You can call them at any time of the day, any time of the night, they're always available. And when required, they have even come to the hospital in odd hours of the day, odd hours of the night. And they are extremely motivated towards teaching. And as I've told you, that 8 to 9, we have something called as preoperative session, which is something which is very special to NIMHANS. Any resident who goes to OT doesn't just straight away go to OT. He's supposed to see the patient in detail, right from history, examination, radiological findings, and he's supposed to present the cases the next day. So whoever is going to OT on that day, 8 o'clock to 9 o'clock, they present the cases in front of the entire faculty, not only that particular unit, but the entire unit of NIMHANS. So you get inputs from all consultants. And this actually prepares you to the final exam. And it is not that you need to read every day. We just read the cases that we are going to. Eventually, at the end of 5 years or at the end of 3 years, you will be well versed with almost all the subjects that you need to cover. And in NIMHANS, it is fortunate that we get exposure to all kinds of cases. Yes. Very rare, it might be a very rare occasion that you might not see some cases. At the end of your residency, you will be so well versed that you will be confident and you will be knowing that, yes, I've seen this case. So academic wise, best. Involuntarily, you will learn certain things. Involuntarily, you will learn because you have pre-op sessions the next day, and that will not give you sleep in the night. You are supposed to read. And the evening rounds, the seniors teach you. So academically, it is good. And surgical exposure wise, you have a graded surgical exposure, vast majority of cases. So you are perfect with that. And another important thing that I've noticed in NIMHANS is the postings, the rotation. We have rotation every month. Unlike other surgical branches, when you go into a particular unit, you are stuck in that. It is commonly seen in general surgery practice where you get stuck to a particular unit, you are in that unit for the whole 3 years. Here you rotate every month, and every month your team changes. You get to work with all residents at the end of your postings. So there is something to learn for everyone. You learn from your seniors, you learn from your juniors, you learn from consultants, because each consultant specializes in different subspecialties. So when you have rotation like this, that is when you realize what exactly subspecialty you need to do. So that gives you a wholesome idea. That is something which is very special about this place. And this is about academic. It's not that it is always work oriented. At the same time, you also have some external postings. As a resident, you get one external posting a month. That is, that posting will be either in neurology or psychiatry. It is comparatively free. That period you can utilize to do your thesis or research work, something like that. This is all about the elective postings. And the elective posting also include morbidity and mortality, which is seen in other institutes also. Every month we have this kind of audit, which will actually help us to evaluate ourselves better. We present some interesting cases and take opinion of all the faculty that will help us to rectify our mistakes. And these teachings are mainly oriented to correct ourselves rather than to point out our mistakes. It is mainly to see that, okay, where we went wrong, where we can correct ourselves. This is all about elective postings. The emergency posting is separate ballgame. You have emergency posting every 3 months or 4th month. That team comprises of 5 residents in each team. It is called as the trauma team, where you have a day team as well as a night team. Day team takes care of casualty from 6 a.m. to 6 p.m. and the night team looks after from 6 p.m. to 6 a.m. So we have around 60 to 70 patients in the trauma team. And the chief resident is the head of the trauma team. He has a final year, a 4th year, 3rd year, and a 1st year. The job of the 1st year and the 3rd year is to be in the triage, see the new patients who are coming, examine them, evaluate them, get a scan. We have 2 CT scan machines installed in emergency, around 20 meters from the neurosurgical desk. So because neurosurgical cases who come to emergencies are real emergencies, and time matters. You need to act upon as quickly as possible and get imaging and make the plan. And patient has to be shifted to OT within 15 minutes. And I'm not exaggerating on this time. We have the patient comes in, sees, scan is done, and patients are shifted within 15 to 20 minutes. And the investigations also come on time, because the resident is not involved in blood drawing. He just tells what is to be done, and the nursing staff are extremely good. They get investigations on time, and patient is on table, and the surgery is carried out. So this is the work of the first years who are actually on table. And in an average, in a 12-hour shift, they see around 30 cases, and which is actually hectic. But as time go by, they become pro at it and they manage well. And they are supposed to give rounds in the morning to all the units. Every unit has a different set of patients who come on different days. Suppose Monday is first unit, you have their unit cases. So this resident is supposed to know cases of all the units. The unit rounds can happen anytime, and he is supposed to give rounds to all units and execute them by the evening, and evening the other team takes care. So in the OT, you have mainly the fourth year, that is the final, pre-final year resident, who is actually the chief operating surgeon in casualty. He does most of the cases. He starts operating from 6 a.m. in the morning to 6 p.m. continuously. And by the time he operates one case here, the other case is induced in the next OT. So this particular thing helps you to be fast, quicker, and swift. At the same time, all these surgical procedures are monitored. The chief resident, someone like me who has completed residency, is supposed to monitor them, teach them how they are supposed to do, and they are performed independently. So right from third year, that is when they return back from Victoria, they start operating. That is graded exposure. So slowly they do some simple cases, then they escalate into complex cases. So by the end of the 1 month of casualty, on an average, a fourth year resident will do around 80 to maximum 100 cases alone, which is actually a tremendous exposure. These cases will be from simplest of the cases to complex of the cases. During these cases, there will be a lot of patients who improve, a lot of complications also, wherein the resident is supposed to reevaluate himself. The seniors are supposed to see the scans, tell him what went wrong, some things which could be controlled, some things which cannot be controlled. And I personally felt when I went through this phase of time that I learned the maximum at NIMHANS. This particular thing gave me a lot of confidence. And at the same time, when you have complication, it taught me that you need to back yourself up and operate the next case. It is not that, okay, I had complications, now I should get half a day break, I should go back to hostel and sleep. It's not like that. Your seniors will motivate you and, okay, fine, these complications have happened. There is another case waiting for you in the next OT, please go and operate. So you need to face that. And that is when your heart becomes strong. That is when you feel that, okay, you can face any kind of challenges. So these kind of surgical exposure actually makes NIMHANS special. And the teaching that comes around, the sense of responsibility of the senior, and any complication happens, it is the senior who stands and takes responsibility. And all these cases which have been operated will be presented next day in pre-op, where all the faculty will see the scan, give their opinion about if anything is wrong, they'll correct it then. So all this exposure is not just, it is being monitored. That is very important. In many state colleges, you have the numbers, you operate, but you don't know whether you are doing it right or wrong. So when there is someone who is experienced, sees your scans, they can catch mistakes. They can teach you, see, this is wrong. You need to do like this next time. So this is how we learn. And at the end of emergency posting also, you have an audit where you present all the cases that have been done, and you will be reevaluated, and people will correct your mistakes. And overall, like, the atmosphere in NIMHANS is very friendly. Like in my entire 6 years residency, I never felt sad. There were disappointments, there were ups and downs, but overall journey was very good. And for someone who comes from an MBBS background into a subspecialty like neurosurgery, which is considered to be toxic and dreadful, NIMHANS provides a very graded exposure and makes you prepared. And I would like right from holding a needle holder to clipping an aneurysm, you will be taught everything at NIMHANS. So you'll have a wholesome exposure. And another important aspect with any central institute for that matter is the amount of research that happens.
Yes, please.
You just don't have the patient number. You also have scope for research. If you are interested in research, apart from your thesis, whether you like it or not, you are supposed to do it. But if you are interested in research, you have consultants who will provide you insights, who will motivate you, and you can easily have a lot of publications, which will definitely help you in future. So both academically and surgical exposure wise, neurosurgery at NIMHANS is probably the best in the country if you are planning. And regarding
everything is carried out protocol wise, I think.
Yeah.
For everything is a protocol. What I felt myself in the central institutes, what's difference from other state colleges, everything is carried out according to the protocol, right?
Yes,
So
sir.
no difference of opinion among the consultants or in the confusion between the residents. Everything is protocol based.
Yeah, and like actually you will have most of the teaching in NIMHANS is corridor based. So we always tell corridor knowledge, corridor knowledge. So when you start reading textbooks at the end of your third year or fourth year, that is when you realize, okay, whatever I was practicing is actually protocol based.
Correct.
So it becomes easier for you to study as well. So, and coming to neurology and psychiatry, psychiatry is probably the biggest department here at NIMHANS. You have a lot of subspecialty in psychiatry. It is not just adult psychiatry. You name a branch, it is present in NIMHANS, and it is probably one of the best in Asia. You have people coming from different parts of the country. And per year, you have around 20 intake of psychiatry residents. And these residents also have monthly postings, 3 monthly or monthly, and they rotate between different specialties. So and they also have a lot of scope for research, and especially when people who want to go abroad after psychiatry, having a degree from NIMHANS adds on to it, especially Australia and European countries. And most of the professors who are in psychiatry in NIMHANS are stalwarts. Most of the protocols that come on mental health or programs that come at government level are all after consultation with the psychiatry team at NIMHANS. And one important thing is people from Karnataka have around 4 seats reservation if they opt for psychiatry. And there are a lot of PDF courses, geriatric psychiatry, Center for Addiction Medicine. So there is scope for higher education as well. And after completing your junior residency, many students stay and do 3 years of senior residency to gain exposure and to do a lot of research. And many of them opt to become consultants as well at NIMHANS. And you name a disease in textbook, you will find it in the department among patients. Yeah. And when it comes to neurology, neurology is also one of the best in the country at NIMHANS. I think you have around 10 residents intake every 6 months. The post-MBBS intake is usually in the month of June. Mm-hmm. So you have 6 post-MD and 4 post-MBBS intake in June and 10 post-MD intake in the month of December. Mm-hmm. So they also have a lot of subspecialties, a wonderful exposure. Their working hours is from around 7 a.m. to 7 p.m. The psychiatry working hour is from 8 a.m. to 8 p.m. It varies. If you finish your work early, you can go. The concept in NIMHANS is you finish your work, you can go back. Nobody will question what you do. But if you do not finish your work, you are supposed to stay back and finish. And you have a lot of subspecialty in neurology as well. And you have PDF specifically in epilepsy and stroke, movement disorder. And all these consultants have made a lot of name in national and international levels. And there is a lot of competition to get into these subspecialties as well. And one other important advantage about neurosurgery in NIMHANS is we don't have fellowship programs here. Mm-hmm. So that gives an advantage for the course residents because they can directly scrub in and interact with the consultants. So this is a brief picture about residency.
It's so tempting, Dr. Nadeem. Really, surgeon like me, I feel like again I have to reconsider my choice and do my residency again in NIMHANS. It's so tempting, and the way you narrate, it's as if live happening in front of I can just imagine myself in the working areas of NIMHANS, and I can feel that enthusiasm among the residents, and that the teacher-student relationship so friendly and such a friendly atmosphere, which will make you a better doctor day by day. So, Nadeem, in my time or your time, we had a separate entrance exam for NIMHANS. Okay, we were all those who are interested in neurosurgery or neurology have to separately prepare for NIMHANS entrance exam. But now it's under INISET. So NIMHANS also. So what is the exam procedure now, and what should the ranking to get into the NIMHANS, and what is the eligibility and what is the entry procedure presently?
Yeah. Yes, sir. Like for neurosurgery, you have two streams. You can come after post MBBS or post MS. So the earlier examination scheme, I actually feel that was better because people who are actually interested in neurosurgery would give that exam. And that time cutoff was like the first 4 or the first 10 would like you would get a chance to get into neurosurgery if your cutoff was within top 10. Now that it is INICT, it is very much fluctuating because if you have people who are actually interested in neurosurgery, the seats might go up by 14th rank because there are only 2 seats every session. So at times the seat might not go at all. There are some instances where once actually nobody had taken neurosurgery here because one resident had taken, he was not actually interested in neurosurgery. Then he opted out. Then that went into 3rd round and 4th round and nobody opted it. And at times like the safest rank I would say would be within 100. And the preparation would be like for any INICT, like for any entrance exam, you need to be thorough with all 19 subjects. But the ranking would be like if you get within 100, you have a fair chance. And when it comes to post MS, it comes under INI super specialty exam. And looking at the trend, the top 4 or the top 6 residents, you have every 6 months you have 3 intake. So the top 3 or the top 4 take up neurosurgery at NIMHANS. So the first institute that goes is NIMHANS, followed by Sri Chitra, PGI, AIMS in that order.
So no, there is a confusion among most of the students that many students keep asking me every day whether can I go for that 5-year residency in NIMHANS, or it's better to take neurosurgery after MS. So 3 years versus 5 years.
Yes.
What's the best option, Dr. Nadeem? You yourself have done 5-year course. So what do you feel at the end?
No, that is a constant debate that goes on. When you compare the 2 streams, the post-MS resident joins when the post-MBBS is 3rd year. So basically when he joins, he is considered to be 3rd year. The first 3 to 4 months, he'll work as a first-year resident because he's supposed to get used to the atmosphere. He's supposed to do ward work and all. The transition, as I narrated, the transition of a post-MBBS resident is gradual. But for a post-MS resident, he has to work as a junior resident for some time. And suddenly he'll start going to OT. So the amount of duration that he gets to progress is less. But at the end, when you take a post-MBBS resident, yes, the academic exposure is slightly more because you are in that stream for 5 years. So you will definitely have a better academic exposure and you will get more time to do thesis. For a 5-year resident and also for a 3-year resident, you have only 1 thesis. So a 5-year resident gets 5 years and a 3-year resident gets 1 year. So you get more time to do thesis. And when it comes to surgical exposure, I would say it is in par. When I compare my logbook with my post-MS counterpart, there might be a difference of 100 or 200 cases. And these 100 or 200 cases would be when I would have been a 3rd-year resident. Maybe I was a 3rd assistant or a 4th assistant. So it actually doesn't matter. When you see everyone, all 10 residents at the end of your residency program, I would say that everyone would be in par when it comes to skills. And I'm not exaggerating it. It is a fact. And everyone would have equal exposure and everyone would be same when it comes to skills and exposure. So choosing a branch after MBBS, none of us will have neurosurgery exposure when you are...
no, not even neurosurgery, not even surgical exposure.
Surgery. Yeah.
See, the main question here is because in MBBS, you will not have much exposure into the surgery. In the theory, okay, and some amount of practical also okay. But as such, how it feels when you handling the when you hold the needle holder, or when you do the procedures, whether it really suits you, or whether you can bear yourself in the OT for 3 hours, 4 hours in the chilling cold. All those things you will come to know only when you are doing MS or in the neurosurgery peripheral postings during your MS. Okay, so after knowing the suitability joining, or just by external appearance, okay, oh, neurosurgery is great, just let me get into that. So after the MBBS, so a lot of difference. One is theory knowledge, one is practical knowledge. So that's the things to be considered.
So one thing that I've noticed is the post-MBBS residents who actually come, they like everybody will be like, sir, I wanted to do neurosurgery, that's why I've come. For unknown reasons. Some will be like, I have seen some procedure. Some will tell, I've seen some movies, some TV series. I was passionate. And some people will tell I liked surgery and I liked
Father is a neurosurgeon.
Yeah, father is neurosurgeon. That is one of the most common indications. So it depends. So I joined because I was interested in surgery and with a special interest in neurology. And you have neurosurgery and neurology residents coming to BMC for their second year training.
General surgery, general medicine.
Yeah. So when you interact with them, when you know the atmosphere there, you tend to get attracted. And you have only one exam. And at the end of 5 years, you finish MCH. That is definitely an added advantage because you need not give one more entrance exam.
Yes.
So if you're sure
2 years.
Yeah. If you're sure okay, I want to do neurosurgery, then definitely post MBBS is the best choice. And once you enter here, things will be a little difficult in the beginning, but the exposure is gradual. So it's not that you will be directly pushed into the OT and you will be given microscope to handle. You will be taught how to suture, get used to tissue handling. You will go to general surgery, Victoria postings at BMC, which is also a premier institute. That particular year is actually very relaxed. This year actually gives you an advantage. And I feel this particular year, people utilize it for giving their MLEs so that they can do fellowships in US. This particular year, people used to study to strengthen their academic knowledge, to write papers. So this particular year actually gives you an advantage over post-MS stream. But people who take a post-MS stream are people who want to explore, they want to see all other branches and later decide whether to choose neurosurgery. Right. Some people feel, no, I need to have good general surgery knowledge and then come into neurosurgery. But when I interact with my colleagues who have done general surgery and come into neurosurgery, the common feedback that they give is that they feel that neurosurgery is entirely different from general surgery, right? From tissue handling to it is different. So they tell that they had to unlearn certain things. Mm-hmm. But when you compare overall, I don't think there is much of a difference.
Now, Nadeem,
if you are unsure,
two things. One, post MBBS who is doing neurosurgery, you think you get enough general surgery exposure during your peripheral posting. Okay, one thing is that. Second, post MS candidate, okay, who is doing neurosurgery, during MS, okay, or from other colleges who come to NIMHANS from all over India, they come to NIMHANS for peripheral posting. Is that sufficient? 1 month or 2 months posting in the NIMHANS? If I'm doing a neurosurgery elsewhere, so I come for training in NIMHANS for 2 months or so. So both this, whether adequate or justified.
So actually, we have a collaboration with Sri Chitra Institute. Trauma they come here for 2 to 3 months. Yeah. And they do not have a trauma postings there. We have a good interaction with them. They get to learn a lot of things. We learn from them. They learn from us. But I still feel like 2 months, 3 months might feel adequate. But having a graded exposure, definitely it cannot match up to the trauma exposure that a resident gets over 3 years or 6 years. But when you compare to other institutes, these 2 or 3 months would definitely be better than those institutes where you might not have adequate cases, where you might operate unsupervised. So definitely spending 2 or 3 months would definitely be an advantage. And a lot of external residents who come from outside get to learn a lot of new things. Similarly, when we also have 1 month of outside postings, we also go to other institutes. There are a lot of things that they do differently, which might be better than us. And there are a lot of things that we do that might be better than us. So there are pros and cons, but I would feel that the 3 years or 6 years exposure is better than 2 or 3 months exposure.
What about the general surgery?
General surgery posting, 1 year is definitely not adequate. You'll have, in that 1 year, you have, I think, 1 or 2 months of other postings like plastic surgery, ENT and these things. So it is more like a chill postings that 1 year. You go more as an observer than doing more of hands-on, because general surgery in Victoria already has a lot of residents.
I know.
So the cutting exposure there with respect to general surgery is not very
great. Yeah.
But yet it will give you an overall idea.
Yeah.
And
Nadeem, you know what? I used to guide my juniors about this 3 years and 5 years thing. See, there are only 2 real super specialties, that is neurosurgery and cardiac surgery. Rest all specialties of general surgery. Okay.
Yeah.
Only these two branches wherein you don't get any during general surgery residency, you don't get any exposure. You don't do any craniotomies or any thoracotomies or sternotomies during your MS. So it's when you enter the MCH neurosurgery or cardiac surgery, it's a totally new to you. Okay, how to do the sternotomy or how to do craniotomy is totally new to you. You might have seen for 15 days, 20 days in your peripheral posting. That's it. But you don't have first-hand experience. So how many appendectomies you have done, how many lap cholecystectomies have you done, it doesn't really matter at all for a neurosurgeon or for a cardiac surgeon. What really matters is how much you're passionate, how much you're willing to dedicate yourself for the branch. That's what really matters for these two specific branches, that is neurosurgery and cardiac surgery. So if you're really passionate, if you're really interested, please directly go for these two branches from after post MBBS only. Or still you're in dilemma. No, I want to explore some more arenas that how is other surgeries also. Then during MS, you can go to the peripheral posting, all the branches like pediatric surgery, plastic surgery, everywhere. Then you see which really is suitable for you, which is apt for you. Then you can decide after MS also, not an issue. So both are like Nadeem told, pros and cons are there, but it's ultimately left to your own interest and passion. Nadeem, what about the strategy? See, after MBBS, directly I'm going to NIMHANS as a neurosurgery resident. What should be the strategy in the beginning? What should be the preparedness? Should I need? Do I need to know about these? How to read a neuro CT scan, all those things beforehand? So, what are all the preparedness required? And about the thesis, you already mentioned about the then. When do you really study? You are doing every day 15 hours of work. So, and remaining 8 hours you sleep. So when do you really study? You get to study and as a surgery resident, how much you're friendly, whatever the environment may be, there will be stress. There will be a lot of stress involved in that. So how do you manage? A big question, please.
Sir, definitely when you come as a post-MBBS resident, you will have a lot of questions. I actually expected a lot of morbidity when I entered, but it was far better. And the common notion I had initially was that neurosurgery was more of trauma. When I entered, that is when I realized that maybe it is just 20-30% of the actual surgical procedure. So when you enter, it is not, it's people there know that what your background is. So they know that, okay, he doesn't know. So the first few months, you will always be tagged with a senior. You need to be a quick learner. Okay. You need to pick up things. And the first important thing that I was taught in NIMHANS is credibility, sincerity. Whatever work that has been given to you, you are supposed to do it. If you do not do it, if you screw up certain things, you are supposed to tell the truth with honesty. You will be screwed, but people will appreciate your honesty. And credibility is something which has been always given importance in NIMHANS. Because mistakes, blunders happen with everyone. All of us have done mistakes, some directly, some indirectly, but you need to accept these mistakes and you need to be sincere at work. You cannot be cocksure. If you get a call, you have CUGs here. Every resident gets a particular, like his own phone. There is particular number given to you. So they will ping you. Any problem, you are supposed to go and see the patient. It's not that you just tell the orders over phone and neglect, because these patients deteriorate quickly. So you need to act quickly. So, and I told that the exposure is gradual. So you don't actually feel ki, okay, you are being burdened or anything.
Correct.
Sometimes you are stressed because sometimes you may not get along with everyone. Some people might not be good to you and all. But I would feel initially when I was in first year, I was so busy that I did not get time to even feel disappointed. Or by the time I was returned back from hospital, I used to feel sleepy. Like there were multiple occasions where I used to be talking at home and I would have slept off.
Correct.
And early morning, somebody from the ward would call me, hey, you're not reached, come fast. All these things would happen. And as I told you, also get external postings. Every month you have 1 month of external posting where you can actually relax. You have offs on Saturdays and Sundays. And like on Sundays, half of the team only comes. So actually you can expect around 2 days off in a month. And you have 1 month of external postings where you go to other departments and you can actually do other works. And you have 1 year of external posting in Victoria, which is actually considered like an honeymoon. So people actually totally forget that you exist in NIMHANS and you actually relax there. See, you are more like an observer there.
Correct.
Visitor. So you.
No. One more thing, what I've seen is in my time, the NIMHANS, that residents were used for neurosurgery opinions and neurology opinions. They used any neurosurgical cases or neurology cases are there. They are the references.
Yeah, and moreover, they are just second year. They will have no exposure and they will be considered as like someone who is a super specialist. So that particular privilege was very good. It was a good experience, and I had returned to my UG college as well. So, but once you come back, that is when the real game begins.
Okay.
Like you are like suddenly considered to be senior. You are supposed to know things. If you don't know, people will tell you don't know. Like that is when you feel that, okay, I need to study. Most of the study comes involuntarily because, okay, tomorrow is pre-op, I need to study. So the approach should be just case wise. You just see whatever cases that come in NIMHANS, you see them. And my professor used to tell that no patient should get discharged from NIMHANS without teaching you something or you learning something from that patient. So each patient should teach you something and go. So when you take one patient at a time, one day at a time, so that is when the wholesome training gets completed. And when you go to OT also, it's not that, okay, I should learn everything and go. You just learn tomorrow's case because you will have like we operate around 2 or 1 case per day in one OT because all these surgeries are long-standing surgeries. And I would like to stress about the fact that these surgeries are long-standing and extremely tiring, both mentally and physically, because these surgeries are they need extreme concentration because you are going through different consistency of structure. You are going through bone, which is extremely hard. Then you have brain, which is soft. Then nerves and vessels, which are extremely delicate. And you have very less margin of error. So when you're operating, you cannot take back the stress at home and operate. Something happened at home that cannot run at the back of. When you're operating, you should be completely thought-free and focus on it. And when you're actually focused, you don't come to know about the time. There are instances where 6 hours, 7 hours has passed and we didn't realize at all. So it's not that, okay, neurosurgery is glamorous, we operate and patient becomes fine. At times you operate long hours and a small margin of error, patient is screwed. So there will, like you will feel sad that, okay, patient is not improving, patient is not doing well, but you need to back yourself up and do well in the next surgery. And it is not that sometimes you do a very good job, patient doesn't recover.
Correct.
So it is not in your hands. You need to work, you need to give your best. The result is in God's hand. And as I said, you should take one day at a time. And if you follow this, exam will be absolutely, it will be very easy. And you get, we have one exam at the end of 4th year, basic exam, where they focus on neurosciences, neuroanatomy, neurophysiology, neuropsychiatry. And then you have a final year exam. And in final year exam, it is the only surgical specialty in India where you actually have an operative exam, where you are actually supposed to operate. And the external examiner will see you, how well you operate, how well you approach the patient. So you are given a case one day prior, you are supposed to see the patient, explain them, take consent, present that case next day. And they come and see you, how well, what is your approach, how well you do a craniotomy, how well you approach the tumor. And then you have a post-op viva where you are asked about the patient's post-op course. And these exams are very practical, I feel. So this is what you are going to do. And neurosurgical training is not just operating. And one important aspect in NIMHANS is the ability to make a decision. That is what I have learned. Because here we don't operate based on scan, we operate based on patient's presentation. You need to examine the patient thoroughly, see the scan, collaborate, and only then operate. When to operate, why to operate, and how to operate is what NIMHANS teaches you. Unlike other places where you just see, scan, operate. Skills are the same, but what I feel you might understand by now as a surgeon that operating is probably the least part of the job.
Correct.
Planning and why to operate is more important than doing the actual procedure.
Nadeem, what about the post-op management? Are they done by the you only, or even the ventilator managements, or if any inotropes are required? All those are managed by whom? The anesthesia residents or your neurosurgery residents? Yeah,
unlike other places, the patients who are operated in NIMHANS neurosurgery, they don't go to ICU because the caseload is so much that we cannot keep all patients in ICU. There are various institutes like Sri Chitra and all, they keep their patients post-op in the ICU. Our patients come to recovery ward. Only those patients who actually require ventilation go to ICU. The post-op management in this regular ward is by the ward resident. be it electrolyte balance or BP management, all these things. We have neuroanesthesia and critical care, who help us when required, but the ICU is completely managed by the neuroanesthesia team, be it ventilator settings or other electrolyte management. And other inputs are given by the surgical team, and the surgery resident is supposed to see these patients also and update. Whatever plan the neuroanesthesia team is executing will be informed to the neurosurgery team. Only then the plan will be executed. So it is just, I would say that the neurosurgery training is not just neurosurgery training. It is something that will make you a neurological surgeon. You should be thorough with neurology, neuroradiology, and neuroanesthesia, everything.
Correct.
And hardly that we see a neuroradiology report. We see, scan, evaluate ourselves, and then operate. And we are not based on, we are not dependent on the neuroradiology report. The neuroradiology team here is excellent. We discuss with them whenever we have any challenging cases and all, and it is mutual. The transfer of knowledge is mutual. They learn things from us, especially as a resident. When I am presenting a pre-op case tomorrow, I discuss with the neuroradiology resident. He teaches me so many radiological things. So you need not read textbooks. Similarly, when I'm examining a patient, I have some doubt, I speak to my neurology colleague. They come, they help us. So this will save a lot of time. When you collaborate with your colleagues in different departments, you need not read textbooks. And when you have seniors to guide you, that will save a lot of time. And the 1-year chief residency that you're doing here, you are chief of the trauma team and you take decisions. You prioritize patients. You might be bombarded with 6-7 casualties. You have 3 OTs. You need to triage them. You need to see scans and judge, okay, who can wait, who cannot wait. So all these decisions actually is something that comes up only when you have experience. So at the end of the training, you will be confident, okay, if I see this patient, if I see this scan, okay, I'm sure he will be stable for so many hours. I can wait. So these type of decision making is something you will not find elsewhere. And that is what makes NIMHANS training different from other institutes. And regarding thesis, see, for a post-MBBS resident, always it is difficult because you go there, somebody tells you about thesis, you have no idea. And most of the thesis topics, unless you are interested, is provided by the faculty here because they know that, okay, you might not have an exposure in this particular field. And in first year itself, you have been given a thesis topic and the guide will always, he will do the job given to him, that is to guide you. And we have biostatistic department also. Neurosurgery per se does not have any statistic training, but the psychiatry department have a brief period of biostatistics training that actually helps them in research work and doing thesis. And you have ample amount of time to do thesis unless you are very lazy. You have 1 year of Victoria posting where you can actually do thesis. For a post-MS resident, as I told, the time duration is less. But however, most of them manage and do well, and most of the theses are submitted on time. And all these theses are actually award-winning theses. They get published. Perfect. So it will not go waste. And if you are interested in research, you can write other papers also. Nobody will force you. If you are not interested, you can actually, you can tell, sir, I'm not interested to write paper and carry on.
And you do spine surgeries also equally or only brain?
This is a good question. Actually, NIMHANS exposure to our cranial is much higher compared to spine. We do spine surgeries quite regularly. All kinds of spine surgeries are done, but when you take the number of cases that are being done, definitely cranial surgeries are more. But when you go to private practice, you have more of spine surgeries in the initial part of your career. So, but the training, it is, I would not say that the training is inadequate. Whatever basic spine training is necessary is done. If you want to specialize, you can always do fellowships or some more time, spend some more time with the consultants here who are actually doing spine surgery. But once you do cranial training here, I don't think any fellowship is required for cranial surgeries. One disadvantage in NIMHANS is you do not have endovascular exposure. Endovascular is completely done by the neuroradiology team. So this endovascular procedure exposure is zero. You will good
only, for a surgery resident, it's good only. If they only do all the interventional thing, then you will get get aneurysmal clipping and other things. They will only do everything.
Yeah, but these aneurysm clipping and coiling, there's a debate that is completely academic, but most of the aneurysms go for clipping here. and they also have a good amount of cases for coiling. But I felt endovascular training would have made it complete, and none of the central institutes actually have endovascular training integrated. GB Pant has, KEM has, so these institutes have endovascular training, but this training can also be done after completing your residency. A fellowship can be done. So that is in a way, that is one drawback. Another drawback is we do not have multi-speciality here. So any patient with cardiac anomaly, we are actually, we start panicking. The patient with some history of coronary artery disease, we don't know what to do. So these patients, we need to shunt them. But one advantage is you can avoid unnecessary referrals from other departments if you have a single specialty. Other than that, overall, it's a very good residency program.
I can see so many awards behind you. Okay, I know you are a very good athlete. Okay, you are good in culturals. So you are a good university level volleyball and other player. Okay, so what was your? I know that hardly you get any time other than your hospital time. How you used to spend your time, the leisure time? What are your hobbies or time pass during the residency?
As I told you, you get to get along with your colleagues a lot, your batchmates, and also most of the free time is spent in going out for food, going out places, picnic tours and all these things, going out for movies and all. I had a specific interest towards sports, and also I used to go to BMC. BMC is hardly half an hour from here, so I used to go there and play. And some people play video games, and some people just sleep. And most common hobby that neurosurgery residents have here is to sleep whenever they get time. So you get time to pursue your hobbies, but frankly speaking, the time that you get is less, because the free time that you get, either you are supposed to study or do other thesis related work or some things that are related to your personal life. So per se, when you enter into neurosurgery, you might not get so much time to dedicate towards your hobbies and these things. That is something that you need to be aware of. There are some residents who make time and go. There are some residents who go to gym every day. No matter how late they come from hospital, they will go. They will first year resident. If you have passion towards
your strengthening is also very important. See, surgery means not just to going and doing the surgery. To have a physical fitness, you need to strengthen yourself, calf muscles, core, everything. So that's equally essential. Can't deny that.
I would strongly recommend to have a good hobby, because that will deviate you. And I always tell my residents that there are 1,000 reasons that are in NIMHANS that will try to keep you back in the hospital. So you need to fight against all of this and come out of the hospital at the end of the day. And once you step out of the hospital, you need to forget everything that has happened.
Don't mix up personal and the professional.
That is very, very important thing that I felt in residency program, because you might have a bad day. You come back to a room, then your parents will call. You will not talk good to them. You will be irritated, and you will not feel like eating. This is a vicious cycle. So once you come out of the hospital, you should not feel, okay, neurosurgery is entirely my life. You should feel that neurosurgery is just part of my life. At the end of the day, you have other responsibilities and other things also to do. So once you step out of the hospital, you should think, okay, neurosurgery is over. Now it is just me. So you should give a lot of me time as well. That is when you can be mentally strong, because it is like a sprint race. You will not realize. When I look back my 5 years, I think, okay, how fast it has finished. So you actually don't get time to recollect, or what do you say?
You are a gold medalist. Okay, even MBBS also, I know you are a very studious boy, and during MCH, you went to next level. NIMHANS getting a gold medal is not a simple task. That shows how much studious you were, how much dedicated. See, MCH gold medal is not just by academical. Okay, they see entire 5 years performance. So you must be very much dedicated, sincere, and very honest, and everything. So for such candidates only they give a gold medalist. So you are that genuine guy. And you are out from NIMHANS means undoubtedly you are one of the best neurosurgeons in near futures. So what after MCH? What are the options available after residency?
Oh, after MCH, I would strongly recommend you should take a break for a few months, relax, and then plan. See, there are a lot of opportunities. You can go into fellowships. If you feel you are interested in a particular field, you can do fellowships. But doing fellowships in India after training at NIMHANS is not much of a help. because you already have a good exposure area. I would strongly recommend you should go abroad and see what people are. Not that they're better than us, but they might do certain things which are different. And in surgical field, unlike medical field, you need to qualify their certain minimum requirements. For example, if you are going to US, you need to have ECFMG certification. You need to complete at least step 1 or step 2. And some institutes might require you to have step 1, step 2, and step 3 as well. So these fellowship programs are very good. When you go there, you get to operate, you get hands-on training, 1 year, 2 year, all those things. And some people actually even do residency there again. There are various instances where people have gone there as fellows and they ended up doing residency and they have settled there. And another option is to continue with institutes. If you are an academic oriented guy, you want to be in institutes, there are a lot of good institutes coming up. NIMHANS is there, Sri Chitra, PGI, a lot of AIMS coming up. All these institutes are doing extremely well. And there are a lot of medical colleges in Karnataka that are actually trying to build up super specialty. So you can go there, build up departments. So you have a lot of opportunities when it comes to academic. If you want to go into corporate setup, there are a lot of institutes that are actually trying to get junior consultants. The growth in corporate might be slow. You need to work under someone, and it is a separate ball game. You have private patients, you need to be extremely good, and you will take some time to make name, and patients will take some time to come to you. So, and making up your own setup is little difficult because you need to invest a lot unless you have a setup already. Putting up a setup altogether as a new venture is difficult. You need to have a lot of monetary backing to do that. So by the end of 6-7 years in your residency, you'll have an idea, okay, what field you want to go. If you're confused, you can take a break, relax, and then choose your field.
And there are always seniors like Nadeem to guide you. Okay. And see, and there is a confusion among so many students. Mr. Ashay Jain is asking, is it post MBBS MCH for 5 years or 6 years? Ashay, yeah. Only NIMHANS in the entire country, only NIMHANS offers this special course of direct 5 years neurology and neurosurgery courses. In other places, it's post MBBS 6 years of neurosurgery. If I am right, Dr. Nadeem, can you please throw some light on that?
Change. Actually, till my batch, it was 5 years plus 1 year of chief residency. Now, what they have done, the exam is at the end of 5 years. This 1 year chief residency, they have made it compulsory. So technically, it is 6 years course, and AIMS also has similar pattern. And Sri Chitra also has a 5 years course, but generally they don't take. Yeah, they don't take. It is always the post-MS candidates who get into Sri Chitra.
And other places, what you have is a DNB, right? DNB 6 years, CTBS and neurosurgery are there, I think.
And Bangalore also has a 6 year course.
Yes, both the neurosurgery and that's also, that's 6 years.
So take frequently. It is like they have interviews, and also it is not that every year they have an intake. One advantage in NIMHANS is you don't have interview, qualify the exam based on the merit INI CET, you just get into this thing. And AIMS and all had
AIMS still follows this thing. Why this thing? Interview. Sri Chitra stopped after I joined. I think mine was the last batch, I think, which faced the interview, and after that they stopped doing it. That Supreme Court order or something was there.
And you had aced in all the interviews, so you had options everywhere.
So, what's your concluding remarks, Dr. Nadeem? See, excellent. I have interviewed many people, and many career counseling I have conducted. I think this is one of the most special one for me, Dr. Nadeem, because you have made a lot of impact on myself. Okay, now I only get like tempted to do a kind of residency in NIMHANS. So that's the impact you made by your talk. Really good one, exceptional session this was. So what's your final concluding remarks for the aspirants, those who are willing to take up neurosurgery or neurology or psychiatry in NIMHANS? And also please tell me how to make the best utilization of the residency, your secrets, because I know you are the best. So your secrets of getting the best out of NIMHANS, please.
No, first thing is you need to have a good cordial relation with your seniors. Like from my BMC days, as you know, like we all have gone through that particular phase where any problem we turn up to our seniors, not just because they are elder than us, it is because they are more experienced than us. They have faced similar situation. You need to talk to them. You need to have good mentors. And as a MBBS student who is actually preparing, yes, see, there are a limited number of seats in these particular institutes, but you only require one seat. So you need to work
Correct.
hard, and like you should not feel ki, okay, my preparation was bad, I may not make it. You need to try. If it is supposed to come to you, it will come to you at any cost. You need to give your best. Yeah. So once you get in here, you need to utilize it well, because it's a responsibility. You have been given, you have been chosen over so many people, and you enter it here. You need to make the most of it. Spend good time. You need to be sympathetic and empathetic. Most important is empathy towards the patient, feeling what the patient is going through. That will actually help you become a better surgeon and a better human being. When you feel, okay, I need to help this patient, that is when you will feel like reading, doing well, doing like going out of the box to help that patient. And one more thing is, never have a sense of competition with anyone, be it your colleagues. I was blessed to have a wonderful colleagues with me. And I would say that though I was given a gold medal, I think the difference would have been 0.0001, because all of us were in par. Maybe on that day I was a bit luckier. And we never had a sense of competition among ourselves. And each of us always helped each other. And as a surgeon, you tend to have an ego. That is common. Ki, okay, I am better than the other. That particular feeling was not in our batch. And all of us helped each other. We used to discuss our problems. We used to discuss our cases. And that particular thing is very much important in a surgeon. You cannot be always in cloud nine, because one single case, so you need to stay on ground and make sure that you treat your colleagues and your juniors well. Not just my message to all the people who are doing residency is that no matter the fact that you might have gone through a hardship in your earlier days of residency, that doesn't mean that you should make your juniors also suffer. As seniors, it is your responsibility that you make their lives better. Correct. Help them, guide them properly, so that the future generation is benefited. And always the younger generation is better than the older generation. They tend to progress better. That happens because the senior generation would have made mistakes and corrected and would have taught them. That is when collective development happens. So I would say that listen to your seniors, collaborate well with your colleagues, respect your juniors, learn from everyone. And most important is respect your teachers, your consultants. When you're scrubbing with them, learn from them, utilize the time, and having utmost empathy and caring attitude towards patient, I think rest will fall in place. You need not do anything special out of the box, be it residency here or elsewhere. If you follow these steps, I think that would be enough.
One more doubt from Mr. Ashay Jain. Do you have a minimal or non-invasive technique like gamma knife included in during your training?
Yeah, that is a very good question. NIMHANS has gamma knife, which was started in 2006. I think only 4 institutes have gamma knife. One is NIMHANS, AIMS, PGI, and Hinduja, and NIMHANS has the latest gamma knife, that is Icon. And we do around 1,000 cases of gamma knife radiosurgeries per year, which is highest in the country. And you have very good exposure when it comes to gamma knife radiosurgery, which is it is not actually a surgery, it is a radiation, focused radiation therapy, which includes neurosurgeon, radiation oncologist, and medical physicist. So you have a very good exposure on gamma knife. And when it comes to minimal invasive surgery, we have intraoperative MRI and we have brain lab system as well as Medtronic. This is slightly like too high for the MBBS residents. These are all high-end neuronavigation systems, which are state of the art. And we recently have bought an O-arm as well. And when it comes to spine, we do minimal invasive spine surgeries as well. And we have endoscopy surgeries. You take a particular surgery, we do it. We do deep brain stimulation, epilepsy surgeries. Lot of specialties are there, and there is no fellowship. So the entire neurosurgery training is like you get oriented to all branches, and you get apt training and adequate training as well, so that if you want, you can specialize or you can practice all of them.
And one more doubt from our non-Indian member from ITAMI, that is, can SARC members, countries, can join into NIMHANS from other countries? Can they do residency or any kind of course in NIMHANS?
Sir, I think after their MBBS or other equivalent exam, they are supposed to give an IMG exam and make their undergraduate degree valid. After that, they are eligible for any entrance exam in India. So I had one senior who had done his residency, his MBBS from Nepal, and he had actually qualified the IMG exam.
FMG exam, yeah, okay.
So not a problem.
So, but not directly, no other. Okay. So Excellent. If any other doubts are there by the members, you can put it in the comment section in YouTube. This video will be permanently recorded for the time to come for all the budding aspirants of NIMHANS. So any doubts of any kind of clarification required, you can put it on the comment section. I will guide it to the mentor and get it answered by him at his convenience. So I feel really sad to end this session actually. Excellent session. In fact, you inspired me a lot, Dr. Nadeem. You have inspired me a lot and made a lot of impact listening to you. I feel same by all the listeners here. And I wish you all the success in the future, and all the NIMHANS aspirants prepare well and get through your dream branch. NIMHANS, see, as per my experience, NIMHANS is known for two things. One is nowhere treated, it will be treated definitely in NIMHANS. Okay, the people only such complicated cases will come to NIMHANS, which could not be treated anywhere else, finally land up in NIMHANS. And there is no instance in NIMHANS which will go undiagnosed by NIMHANS. Okay, all the patient will be diagnosed properly. First of all, any difficult case, any kind of case will be first diagnosed properly at NIMHANS, and it will be treated, and then patients go home. That's a dictum which I have been hearing from my MBBS days. Okay, hope the same thing is continuing. Yes, the teachers are also, their consultants are also so much passionate. They come earlier than the residents, and they go later than the residents. They are so much dedicated into the work and so much passionate about, like he's mentioned, about the teaching maybe, or maybe training the residents, or also in the patient care. And they have totally, unlike other, it's a total exception for other government setups. Okay, they have high quality treatment as well as the training going on in NIMHANS. Very exceptional case in our country. So that's the best place for one to be get trained in the best of the best hands. And it's a combination of both learning and also, yeah, excellent scope for research as well. If you are a research oriented person, NIMHANS is again the best place. So I wish all the NIMHANS aspirants all the success in their upcoming exams, or those who are already in NIMHANS doing great. And there are other people like Nadeem to guide you, help you all. And I also request Nadeem once again to take us few classes about the basics of neurosurgery at your convenient time for the White Army members. Thank you so much, Nadeem. Thank you for your kind inputs and all the valuable information you shared with us. We will be very much thankful and grateful to you. Thank you so much.
Thank you, sir, for this opportunity. Definitely, you have been doing a commendable job. You have been always a good senior right from our MBBS days. We had a very good time with each other, and you were always a role model. And you have been training a lot of residents. And one of your core member is my junior in NIMHANS, and you have motivated and encouraged them. And probably the best thing that a senior can do to a junior is to encourage him and motivate him. And you have been doing for lakhs of students, and each one of them is actually doing good in their particular field. And I don't know how well you manage your time. I seriously wonder at times. You have always been an inspiration for all of you, sir. Thanks a lot.
When you told about my core member, I remembered one more core member. Actually, this session was particularly conducted for that particular core member only. That is Dr. Keshav Garg. He will be coming this time. Okay, he'll be coming this time mostly to NIMHANS. He's excellent. He's from Mbbs in New Delhi. Okay, and he has got a neat 96 rank. He didn't take up a seat. Again, NACT also very good rank he has taken. Mostly he'll be coming to NIMHANS neurosurgery. Okay, and he had a particular doubt. Since you brought out this topic of core member, I remembered, or else I would have again forgotten. He's from North India, from Delhi. So he has the fear of this language issues in Karnataka, whether can he cope up with the Kannada or whatever local language in Bengaluru, and able to converse conveniently with the patients. How do you relieve his apprehension?
It's a valid question, but sir, once you enter here, no, you have some Kannada training classes and all. But once you start, one casualty is enough for you to teach Kannada. And in neurosurgery, you don't require
Hardly
many
10 words.
is all that you required.
Of
So
exam.
at the end of your training, you learn Bengali, you learn some Tamil, Telugu, all these things. And there are many North Indian students who speak Kannada better than all of us.
Mhm.
So that shouldn't be a problem. And people here in Bangalore and Karnataka do know Hindi. So if people think that you do not understand Kannada, they will try to communicate in Hindi or English. So that shouldn't be a problem. So he will definitely not face any problems with respect to language. By the end of his training, he will be well versed to understand the complex of the symptoms in the native language of the patient.
And to add to that, I myself have written a book, English to and English to Bengali, all the languages. And many NIMHANS residents message me every day asking for that particular book. Okay. And they use that, especially psychiatry and neurology, because that book has been written in that neurology case taking proforma only, that everything has been included. So all the questions are there in the written. So most of the residents are using my book there. So that's always there to help you. It's a very handy book which can be kept in your apron pocket and can be used for history taking and examination, especially all the neurology questions subsets are included in that book. So you can make the best, like, and just like Nadeem mentioned, it's a matter of a week or a month maximum.
Casualties.
Yes, more than enough. Don't be just it will be a blunder if you don't take up NIMHANS just for the language issue. Okay, don't do such blunders and all. See, I myself have been to Bengal. I didn't even know Hindi before that, and I learned Bengali in a matter of 1 or 1.5 months. Okay, so easy. Learning language for your IQ, for a medical student's IQ, learning a new language is not at all difficult. Okay, so look at all the positive aspects of the NIMHANS and always aim for the best. Okay, and all these small hurdles will be taken care automatically. Thank you so much, sir.
It is not the language, but the emotion that you need to.
Emotion really matters. Correct. So when you can by body language also you can talk to the patient.